Right, let's get into our next discussion right now. The United Nations is worried that the humanitarian crisis in Nigeria's northeast may linger for a long time if it is not tackled within the next 18 months.
To this end, UN Security Council is asking the international community and the Nigerian government to redouble their efforts. Doshima Abu reports.
This is the first time ever a team from the UN Security Council is visiting Nigeria since the Boko Haram crisis started in 2009. The 7-year insurgency has led to the death of about 20,000 innocent citizens, and millions of others have been rendered homeless and now take refuge in IDP camps. A large number of others, including some of the Chibok girls, are still in captivity, and so this visit for some Nigerians is long overdue, but it's better late than never.
Is that the crisis of the Lake Chad Basin is one of the largest but also the most neglected and forgotten crises, and we want to shine a spotlight on that crisis so that the whole world, including the governments of this region, can step up in response to the crisis before it is too late. Part of that crisis is about terrorism, and we stand with the governments and the peoples of this region, but it's not just terrorism. It is also a humanitarian crisis that is unfolding on a scale hardly imaginable. We have been struck by the individual stories that we have heard in the IDP camp in Maiduguri from the women whose husbands had been killed by Boko Haram, who have lost children to Boko Haram, and who are now struggling to feed themselves and their families, who are struggling to give their remaining children the education that those children deserve.
Girls in particular are at risk for sex and gender-based violence, and of course at risk for forced recruitment by Boko Haram. We also saw the importance during that visit of the key work being done by the UN humanitarian team and by the NGOs who are the implementing partners.
18 months.
Why 18 months? Not 12, not 24.
18 months is so critical in the Nigerian context because to address the serious humanitarian situation in northeast Nigeria. Failure to do so, the situation is going to protract and the impact is going to be heavy on the population that is already affected by this crisis.
The humanitarian situation in the region is getting worse by the day. Even the few aid workers on ground are overwhelmed. Many of the agencies like UNICEF say they are short of funds to operate. This is due to slow response from international donors. The aid agencies also blame the Nigerian authorities for not telling the world the extent of the crisis. But just recently in Norway, the government cried out for help. Pledges were made by countries and donors, and many directly involved believe now is the time to redeem.
So Nigerian government made an interesting pledge in Oslo. We are just from the Minister of Finance and National Planning, and he explained to us that this government will effectively disburse the money through the normal budget process.
But in the end, neither the military fight against terrorism nor the immediate humanitarian response will solve these protracted crises. What is needed in the end is long-term development, jobs, environmental.
These delegates describe as pathetic the living condition of the IDPs and promise to inform the Security Council the true situation of things once they return to New York. They are hopeful that appropriate decision will be reached to help address the situation. Doshima Abu, TVC News, Abuja.
All right, that's the background to the discussion. Now, the point is, when it comes to humanitarian situation, especially in the northeast or anywhere there is conflict, what is reported sometimes doesn't capture what is on ground.
In most cases, the issue of underreporting of the crisis, sometimes for political reasons, really. And there are sometimes some exaggerated facts also for some political reasons, or the issue of trying to garner aid from the international donors. So, comme ça, really, but at the end of the day, who suffers when it is underreported?
Now, even in addition to that, governments themselves sometimes, because these are your citizens, and the first responsibility of government is to cater for these people, the welfare and their security. If one way or the other there's a breach at the process of taking care of these people, and then they have a situation, why not be honest about how to take care of what you can do for them and all of that? That's a big question.
It is a big question, really.
All right, we have joining us right now by the representative of UNICEF in Nigeria, Mohammed Fall. Mohammed, good morning.
Good morning.
Good morning.
All right, we're going to come to you shortly, but we have to go on a break now before we start up with you. So stay with us right now. Let's go on a break. We'll be back shortly.
Glad to have you back. It is our second big story, talk time really for now, and we are looking at the humanitarian crisis in the northeast and perhaps the Lake Chad Basin region in general. Joining us from our Abuja studio is the UNICEF representative here in Nigeria, Mohammed Fall. Mohammed, glad to have you join us. It's a good thing now that the crisis in the northeast seems to be garnering more support or some attention from the international community. But tell us exactly, what is the scale of the humanitarian crisis there?
Thank you very much. First of all, thank you for having me in your program. Let me start also by wishing a happy Women's Day to all the women in the world, and most particularly the women that are suffering, mainly here in Nigeria. Let's remember that the crisis is affecting now more than 8 million people who are in need of humanitarian assistance, and I can say that 54% of them are women. The scale is also can be measured through the number of IDP. We are talking about 1.6 million IDP, including 1.4 only in Borno State. We are talking about more than 4 million people who are at a high risk of being food insecure. We are talking about 450,000 children who are in what we are calling severe and acute malnutrition, which could be a major leading cause to death. Without mentioning also the difficulties in terms of access to health, water and sanitation, difficulties of accessing to education, mainly for children, knowing that education is something which is a basic right of every child and which can also help to heal the crisis and the humanitarian suffering that the people are facing.
If we follow what the UN says, the UN indicators for declaring areas suffering from famine, which we got some time ago, that 20% of households not being food secure, above 30% of people suffering from acute malnutrition, from what you've described now.
Who are in what we are calling severe and acute malnutrition, which could be a major leading cause to death. Without mentioning also the difficulties in terms of access to health, water and sanitation, difficulties of accessing to education, mainly for children, knowing that education is something which is a basic right of every child and which can also help to heal the crisis and the humanitarian suffering that the people are facing.
If we follow what the UN says, the UN indicators for declaring areas suffering from famine, which we got some time ago, that 20% of households not being food secure, above 30% of people suffering from acute malnutrition, from what you've described now. Has it not surpassed those figures?
I think what we should do also is to see behind those figures that there are human beings. As I say, it's true that UN is alerting not only in northeast of Nigeria, but in other parts of the world, which are in the age of facing famine, or which are highly in a position of being food insecure. But what I want is that the people see that behind those numbers, 20%, more than 4 million people, 100,000 of children, these are human beings that are at risk of dying. These are human beings that are suffering, And what I think needs to be noticed is the fact that the international community has wake up in the question, in looking at the Nigerian, northeast of Nigerian crisis as one of the most important crises in the world today. The fact that we had 10 days ago the Oslo conference, the fact that before the Oslo conference we have the entire donor community visiting Maiduguri and visiting the northeast of Nigeria and seeing firsthand the suffering of the people there. The fact that all this major event has been followed by the visit of the 15th member of the Security Council to also have in the ground and have a first information show that there is a wake up from the international community. There is a break also in the neglect that this crisis was facing in the eye of the international community.
All right, Mohammed, talk to us about areas that cannot be accessed because of the crisis there in the northeast.
What I can say is that we do have access as a major challenge for humanitarian delivery. We are facing now, it can be said that today, if I take the Borno state out of 27 LGA, almost 25 are accessible. But access can be also in a LGA level, but not in the entire area. It could be in the metropolitan area, it could be in the capital city of the LGA, it could be on some pocket of the LGA, but still we are facing large number of people who could not be accessed. Estimates are talking about over 400,000 people, up to 800,000 people who are not in a position to be reached today. And I think that's also a major concern, because we know that those who are behind those line of fighting, those who are behind those lines are in a very bad shape. And we can witness it. We have seen recently population newly accessible presenting indicator of malnutrition or presenting indicator of disease, which are extremely bad. And I think that remains a major concern in this crisis, access. And I think we are doing a constructive engagement with the army. The Nigerian army is facilitating access for humanitarian deliveries, but still there are pockets of people we are having challenge to reach today.
Quite a number of international donors have made pledges. The World Bank pledged about $2.2 billion. The EU grant is there. The US gave about $45 million, and quite a lot of work going on now. But the report is that most of these pledges are not being redeemed. So tell us what the UN and what other agencies are doing to scale up intervention, really.
What I can say in this regard is that the 2017 humanitarian response plan has pledged over $1 billion, which is a significant increase compared to what it was in 2016. But as you know, those are pledges. We have today collected over 4% of that amount. But let's remember that recently, as I say earlier, in Oslo, the international community met in the invitation of the German, Norwegian, and Nigerian government to focus and pay attention to the crisis in the northeast of Nigeria, but in the crisis also in the Lake Chad state. It has come with a very promising figures of over $600 million pledge, but these are pledges, and we are expecting that more will come in this front, but it will take time for this funding to be released. It will take time for this funding to be transformed into concrete operation that will reach the beneficiaries. But we are working tirelessly on this with the entire humanitarian communities. And when I say humanitarian communities, it means the international NGO, it means the donor community, but let's also highlight the fact that the government of Nigeria is also very committed. More than $600 million dollar were pledged in Oslo from the international community, but the government of Nigeria itself has pledged more than $1 billion to come in response to this crisis that I have described earlier.
All right, you've given us a picture between what is pledged and what is on ground right now. So if we jiggle them together, how much of shortfall in funds is there right now?
The overall shortfall, I can say, is around 90% in terms of funding which is in hands today. If I bring it down to what UNICEF appeal is, because you have the humanitarian response plan, but you have the humanitarian action for children. Our humanitarian action for children was around 147 million, out of which we have raised today like 39 million. which is figures of 27%, meaning that we are still looking for 73% of what we need to respond to the need of children for 2017. And let me highlight also that it's not only that we have a gap in the total humanitarian action for children, but there are areas that are suffering more from that gap than the others. I can highlight, for example, WASH, which is very critical in terms of life-saving, facing a gap of 83%. I can highlight also health, which is, as you know, very critical also for life-saving, which is facing a gap of over 80%. I think what we need to do now is to continue to build on the generosity of the international community, is to build also on the commitment and the pledge made by the government of Nigeria and try to bring the resources as quickly as possible, because we are facing life-threat humanitarian need. And I think there is any second which is lost could be translated into a death of a child or a death of large number of children.
All right, the UN Regional Humanitarian Coordinator for the Sahel region, Toby Lanza, I'm sure you know him, has said beyond the aid that you give to the people, beyond giving them food, that it goes beyond that. If you want to stop the issue of humanitarian crisis, that some kind of much more engagement and trade development. What's your take on that?
Yes, I do know very well Toby. I think he's right by raising this, because let's not forget that this crisis has just come to exacerbate a certain number of issues that was there. That was linked to limited access to basic services, that was linked to some of the structural problems that those regions were facing. It's true that we have an imperative to act, and act very urgently on some of those life-saving issues or life-saving threats. But I think we have also to combine it with the vision which look at the longer term, with the vision that look at the structural issues. If I take, for example, an area we are working in, we all know that today saving life of children, a part of it will be also getting children to school, raising children on a value of tolerance, raising children on a value that can help them to contribute to rebuild the social fabric of those areas. These are areas which are not maybe immediate and life-saving, but these are components that are extremely important in our visioning. And I am really I'm thrilled anytime I go to Maiduguri, I go to the LGA that are in Borno State, I see the leadership combining this vision of acting on the most acute and urgent need, but at the same time setting the tone, setting the vision for what needs to be done in the longer term. Because the solution of this crisis cannot be a one-time or cannot be a one-day solution. It has to be also packaged and built in a longer-term vision, which look at the development of those areas, which look at the access to basic social services, which look at also the protection issues that are some of the underlying causes that we are facing and that have led to this crisis.
All right, Mohammed, let me ask you this last question before maybe we'll let you go. Beyond the issue of funds that you have given us a picture on, what other strategies can be adopted to help salvage this humanitarian crisis there in the Northeast?
Specifics, please.
I think beyond the issue of fund, we have also an issue of coordination. Because, you know, some of these crises, when they happen, the generosity is multiple. Everyone wants to come and help. But if we are not helped, if the help is not delivered in a condition which are very much coordinated, which are integrated into a vision, as I say earlier, which gives to each party its responsibility, avoid duplication, avoid overlap, look at where the gaps are and prioritize those areas where we have the highest gap, the response might not be reached, might not have the impact which is expected. And that's why I think that it's not only an issue of money, it is also an issue of coherence, of consistency on the way resources are deployed, on the way partners are distributed into different areas, on the partnership that is built with the government, on the partnership which is built with the army, because as I say, the army is the area, are the component that are facilitating the access. All of these things need to be worked out to have a coherent and a response which give the expected outcome.
All right, Mohammed Fall, UNICEF representative in Nigeria. Thanks for talking to us on TVC News right now. All right, let's go on.
Thank you for having me in your program.
Thank you very much. Thank you. All right, let's go on a break and then we come back to discuss more on what's going on in the Northeast.
It is still talk time, and we're still talking a humanitarian crisis going on in Nigeria's northeast and international efforts, and of course Nigerian government's efforts to curb the crisis. According to the report we had earlier, the time lag really is 18 months.
18 months.
If nothing is done within 18 months,
it's going to be catastrophic.
Catastrophic. Okay, so we have joining us Secretary Nigeria Red Cross of Borno State, Mohammed Fall. He's joining us right now. But before we bring him in, let's give you more information on what we are talking about.
Now, looking at perspectives to this issue right now, Nigeria's northeast has a land area of about 280,000 square kilometers, and that's about 33% of Nigeria's landmass. Now, the region comprises of Borno State, Adamawa State, Yobe, Bauchi, Gombe, and Taraba states.
The region is the worst hit from an insurgency that ravaged the nation for close to 8 years. Boko Haram's large-scale destruction in Nigeria's northeast have reduced many communities to ghost towns, leaving many dead and thousands displaced.
Worse still, this has spiraled into a humanitarian crisis that mirrors serious violations of international humanitarian and human rights law, insecurity, acute food and nutrition crisis, chronic underdevelopment and lack of basic amenities that need urgent intervention, especially in the most affected states of Adamawa, Borno and Yobe and the Lake Chad region as a whole. Especially in the most affected states of Adamawa, Borno and Yobe and the Lake Chad region as a whole.
Hunger and malnutrition rates have reached an alarming rate, and as the humanitarian crisis continues, mortality rate, of course, is on the rise. According to the UN, the Northeast crisis is the fourth largest humanitarian crisis in the world. That's after Syria, Yemen, and Iraq. The UN Security Council has described the insurgency crisis in the northeast Nigeria and the Lake Chad Basin region as the largest and most neglected humanitarian crisis the world has ever witnessed. What exactly is a humanitarian crisis? That's a big question.
All right. Now, a humanitarian crisis represents a serious threat to the health, safety, security, or well-being of a community or other large group of people, usually over a wide area. Now, at least 14 million people are affected across the northeast and Lake Chad region from the statistics we have. In the three most affected states of Adamawa, Borno, and Yobe, an estimated 8.5 million people are in need of humanitarian assistance. More than 50% of these number are children.
According to Mohammed Fall, now he said we have about 80 million people displaced. About 50 million of them are women as we speak. Borno State is the hardest hit by the conflict and hosting about 69% of all internally displaced persons and 52% of the estimated people in urgent need of humanitarian assistance. According to the 2017 Humanitarian Response Plan, a projected 5.1 million people in Adamawa, Borno, and Yobe states in Nigeria's northeast will be food insecure this year if response to the humanitarian crisis is not scaled up.
We discussed that earlier. Now, the United Nations is also worried the humanitarian crisis in Nigeria's northeast may linger if it is not tackled within the next 18 months. Now, currently, there are 75 partners providing humanitarian assistance in Borno, Adamawa, and Yobe, including 28 international NGOs, 20 national NGOs, 18 government agencies, 8 UN agencies, and the Red Cross movement.
The sectors that require urgent attention, according to the 2017 Humanitarian Response Plan, are food security, nutrition, health, protection, shelter, and non-food items, education, water, sanitation, and hygiene. Response and recovery plan, displacement management systems, coordination, logistics, emergency, and of course, telecoms.
Now, that's the basic of what we're trying to do here. So when you make all the consideration of what is involved you get to know why there are challenges in some of the parts. Now, Mohammed Fall earlier was talking about access to areas. And when you don't have access to some places where victims of all of this phenomenon are, you may not even have the total number. So even the 18.5 million they're talking about is possible. There are other people who should add up to the number that are not counted because some areas or terrains cannot be accessed, either because of the land, the topography of the area, or security issues and all of that. Now we have joining us Mohammed Bama, Secretary of the Red Cross in Borno State. Mohammed, good morning. It's good to have you join us right now. Mohammed, are you there? Can you confirm that you can hear us?
Yes, I can hear you. Good morning.
Oh, good morning. Now, first, let me start this way. You are on ground. You've visited lots and lots of the camps where people are. From what you see on the ground and what you hear on the media, is the situation underreported on TV and radio and newspapers and all of that? Mohammed, can you hear me?
Yes, I can hear you.
I just asked the question that you are on ground. From what you see and what you hear on the media, is the situation on ground, the humanitarian situation, is it underreported or over-exaggerated? Let us hear from you.
Yes, actually, as the context, the humanitarian crisis, and we have been battling with the current situation for the past 7 years. And now getting to 8 years, and of course, it affected the larger populations, and mostly the populations lost all means of livelihood. That means thousands were displaced and many were homeless. So as the case may be, yes, there are huge humanitarian needs, and which will be collective responsibilities for all actors to come in and then render their best. As far as the Nigerian Red Cross is concerned, as well as the International Committee of the Red Cross, ICRC, which we have been working assiduously to give support to the affected populations. Right now, we have been done several interventions within an IDP camps and the host communities, and now we have embarked on the outreach activities where we have been reaching populations outside the state capital. Which has been for long. For instance, still we have been doing very major interventions in Kalabarige, as well as the other locations where we keep providing to the populations assistance in the terms of food assistance and NFIs, as well as the promotions of the hygiene promotions. We also incorporate the IDPs so that they should serve as service providers, not only service beneficiaries. And that's what makes the Nigerian Red Cross distinction from other organizations, because we work with the communities and our volunteers spread in the communities. So we have been doing our best to bring smile to the face of the vulnerable population.
All right, Mohammed.
Yes.
Yeah, we appreciate the efforts and all that, but we'd like you to paint a picture for us, because the reports we're getting is that if nothing is done in the next 18 months, there will be a catastrophe. Are things that dire in the parts of the country? Mohammed, can you hear me?
Yes, the emergency response is a multi-sectoral approach, and all other organizations, including the authorities, are doing their best to respond to the situation. And as far as we are concerned, we are scaling up to make sure that we deliver our services and we reach out to the vulnerable populations, especially in more wider areas such as the promotions of healthcare services, especially the primary healthcare facilities, provisions of potable drinking water, as well as supporting the communities with shelters. Every organization has an area of mandate to respond, and of course, I'm sure other sectors are also doing their best in addressing the situation.
All right, Mohammed, maybe you can't hear our questions clearly, but I am glad you're still giving us information there because that is what we all need right now. But if you can hear me now, I was asking earlier that people who are not in the Northeast, if you can hear me, they get reports on TV, on radio, on what is going on in the Northeast. But you are on ground. But what you see on ground, is it the same thing with what you hear on radio and TV about the Northeast?
Actually, it has been.
Mohammed, are you there?
Yeah, actually, it is cutting up, but I got some of the questions. Actually, the report has been exaggerated. But as far as we are concerned, yeah, we are doing our best in delivering the services to the population. And of course, you know, we have a wider spread and we are responding to the situation. As I earlier said, every organization has a mandate and everyone is trying their best to address the situations, including the authorities, especially the NEMA and SEMA, who are also playing a very key role. And as far as the Nigerian Red Cross is concerned, as far as the International Committee of the Red Cross, ICRC, are concerned, we are doing our best in scaling up our services, and we are scaling up to reach out to the population, especially intensifying efforts towards reaching to the outreach areas, because as far as continuously we keep registering new arrivals of IDPs in our various IDP camps, and of course, upon arrival, we respond to their needs. And we are also training our volunteers to continuously providing these services to the affected population. But remember, we are now about to respond phase where most populations are willing to go back to their locations of the origin. And then, of course, the authorities, on the other hand, doing their best to make sure that they provided enabling environments so that the IDPs can go back to their communities of origin and settle. This includes the provisions of the basic amenities, improve all sectors so that they should have a very good lifestyle.
All right, Mohammed, let's put you on hold and go on a break. We'll be back shortly. Stay with us after this break. Right, if you're just joining us, you're watching TVC Breakfast. We are talking about humanitarian situation in the northeast of Nigeria. Now, the report now is if in 18 months nothing is done to scale up intervention from international donors and governments and all stakeholders, then we're going to have a very big situation in the northeast in Nigeria. From the records we have, Nigeria is the fourth country with the largest humanitarian crisis in the world right now after Syria, Yemen and Iraq. Okay, but we have Mohammed Bama with us. He's the Secretary of Red Cross in Borno State, giving us a situation report, even though he couldn't, I don't know, there seem to be connectivity issues, but he's giving us information, which is what is important. But the United Nations Security Council visiting mission to the Lake Chad Basin region have arrived in Nigeria. They were around, going around the areas there, and a delegation which met with the northeast stakeholders in Maiduguri, Borno State on Sunday is expected to meet with Nigeria's acting president Yemi Osinbajo in Abuja.
The visit is part of the UN Security Council's mission under the UK presidency. They must have met the acting president, definitely, and to the areas devastated by Boko Haram terrorists in the countries of Lake Chad Basin. There you're talking about Nigeria, Cameroon, Chad, and Niger. The mission to Nigeria will get first-hand information, because that's why they are saying now that in 18 months they've assessed what is happening, and they're saying in 18 months if nothing is done, there will be bigger problems on our hands. This is the first time the UN Security Council is visiting Nigeria.
And substantial help may soon come the way of victims of Boko Haram, with the international community now stepping in to lend support. That's what we've been talking about all the while. Donors at Oslo Humanitarian Conference, which held in Norway, pledged about $700 million to support aid operations in the region.
Nigeria's foreign minister revealed this to newsmen in Abuja and expressed gratitude for the kind gesture, but noted that more needs to be done to ensure aid gets to Nigeria, Cameroon, Chad, and Niger. The mission to Nigeria will get first-hand information, because that's why they are saying now that in 18 months they've assessed what is happening, and they're saying in 18 months if nothing is done, there will be bigger problems on our hands. This is the first time the UN Security Council is visiting Nigeria.
And substantial help may soon come the way of victims of Boko Haram, with the international community now stepping in to lend support. That's what we've been talking about all the while. Donors at Oslo Humanitarian Conference, which held in Norway, pledged about $700 million to support aid operations in the region.
Nigeria's foreign minister revealed this to newsmen in Abuja and expressed gratitude for the kind gesture, but noted that more needs to be done to ensure aid gets to the way of many.
$100 million. $400 million for immediate use this year, and $300 million for next year. We were hoping, we put $1 billion as the amount, minimum amount we're looking for. And we're still hopeful of getting at least that amount, because there were some other countries that we hope will also make a pledge, but whose budget cycle did not coincide with this period. So, you know, we're immensely grateful, but a lot more still needs to be done.
More still needs to be done. Mohammed Bama is with us. He is the Secretary of Nigeria Red Cross. A while ago, you were telling us about your best. But the question is your best good enough, that you don't require aid, or is the Nigerian government doing its own best? Mohammed, can you hear us?
Mohammed, are you there? Are you still there?
Yes, we have the issue of connectivity. I don't know.
Oh, okay. But if you can hear right now, Busalami is asking you as to, when you say you're doing your best to help generally, how much impact is that help that you're rendering? How much of it is when we compare them to what is needed on ground?
Yes, you know, Nigeria Red Cross.
Go ahead, Mohammed.
Okay, you know, the Nigerian Red Cross, since the beginning of the insurgency, we have been responding to the other situations, and we are committed to do more, especially with support from the International Committee of the Red Cross, ICRC, and of course, recently the Secretary General of the International Federation of Red Cross and Red Crescent Societies, IFRC, visited Borno State, and he has seen things on ground, and right now are making efforts to make an appeal so that we should come with a Marshall Plan to support the populations affected, not only in Borno, for the entire northeast. And then, of course, we continuously scaling up in our services to support, and we put in so much machineries to make sure that we deliver what we're supposed to do to the populations as the mandate of the national society, that's the Nigerian Red Cross.
What are the challenges? What are the challenges so far in doing your best, according to you? What are the challenges you're faced in doing your best?
Yes, you know, the major challenges, you know, is the issue related to the funding of our programs, and right now the International Committee of Red Cross, the ICRC, and then the International Federation of Red Cross and Red Crescent Societies, IFRC, doing their best in addressing the situations. And then the other issue, the issue of the security or the accessibility to the affected populations. Despite the fact that we are embarked on outreach activities, but still there are some locations that we could not access simply because of the situations. And remember, we make sure that we follow the the process involved, especially the safer access, where we have safe access to the victims, and then we deliver them the services. Also, information varies. As I earlier said, we keep receiving new arrivals of the IDPs from the liberated communities, and then these IDPs need urgent attention in terms of emergency food support, in terms of provision them with shelter, as well as the health care services. And we have delivered services and dispatched our teams in the outreach areas. For instance, we are currently responding in 7 LGS for that's the Kala Sige, Monguno, in Damboa, in Kukawa, in Pikwa, Gala, both in Maba. We have been responding and are ready to run in Calabar, get to continue distributing relief items to the population. So these are also another key area that we need to. And then also information, at times before we got information, it's getting late. So, but we are making sure that we receive the information and then deliver our services to the population. Also, it comes back to the issue of the coordination, which the authorities are in better position, like NEMA, SEMA, they are the ones to lead the coordinations to ensure that the assistance we are provided to the affected populations on timely and in a professional manner.
All right, Mohammed, you talked about some of the IDPs willing to go back home earlier on. Give us a perspective. What is done to deliberately help them to go back home, and how many of those people have gone back home so far from the IDPs?
Yes, right now, for instance, in Mobar, in Damascus.
Go ahead, Mohammed.
Yes, right now in Mobar, for instance, in Damascus, when the routes were open for usage, a number of IDPs left Maiduguri to do, and as per the last intervention we did just in 2 weeks ago, not even 2 weeks, we provided assistance to over 10,000 families in Damascus, that's the headquarters of the Mobar local government area. And the population were staying in the IDP camps for so many years, and they are willing to go back. And then we are also trying to support them, especially when they go back, encourage them, especially, the majority of the inhabitants are farmers, and farming activities could not take place. But in areas where there are chances, we support them with agronomy so that they should be able to start irrigation activities, so that we support them with tools, farm inputs, seeds, as well as the fertilizers. We are also involved massively on the rehabilitations of water points and channels, as well as to support them to start these activities. We are also looking at inwards where we come up with more programs like cash for work or food for work, where we engage the community members, that is the returned IDPs, to clear certain locations, maybe engage them in cleaning activities, and then we support them with cash and then also for food on the other hand. This we want to make sure that we engage them so that we also try to empower them. Right now we are, through the support of the ICRC, have been supporting a number of widows into a microeconomic initiative where they have started income generating activities, empowering them so that they should be able to provide assistance to their immediate dependents as well as to the extended family. So we are doing our best to make sure that we continue with these services. And for instance, in other locations also where the IDPs are willing to go back, also the Red Cross volunteers are willing to go back. As I'm talking to you now, we have teams on ground in all the outreach locations where they are delivering their services as well as working with the returnees IDPs within the host communities, especially in the LGA headquarters of the area earlier mentioned.
All right, the friendly attack or the friendly fire that took place in one of your locations some time ago, has it in any way affected your commitment to this work?
Actually, no. We wish to recall of the run air misfire incidents of the...
Please go on.
17 January. Right now, our teams are ready and they can support team will be left Maiduguri to run today to continue with the service to the humanity, where our volunteers are willing and very much committed to continue with this service to the humanity. The incidents cannot deter us, and we are very much committed. And above all, Red Cross volunteers, especially the displaced Red Cross volunteers, are willing to go back to their communities of origin to continue with the service of the humanity. And as far as we are concerned, we are ready to support them and encourage them as well as equip them to deliver these services, because right now the International Committee of the Red Cross, ICRC, is working assiduously to provide enabling environment in terms of office structures, in terms of logistics, as well as required tools to enable this team on ground to continue with their services. Above all, training and retraining of our volunteers in various core areas so that they should be able to continue with what we are doing. And of course, our interventions have really made an impact, and the populations are always mentioning all the time that they touch their lives. That's the best way we are on board, and we are committed to give our services to the church.
Okay, Mohammed, thank you very much. It seems we have the distortion of your audio there, but we can't hear much of what you're saying towards the end. But we must thank you very much for talking to us this morning, giving us perspective of the humanitarian situation in the northeast of Nigeria. This is where we come to the end of today's edition of the program. Tomorrow we'll be back again with other topics, discussing what's affecting and of interest to Nigeria and Africa by implication. I am Mike Okwache.
And I am Busola Mitunwashi. Bye for now.